cases have been reported in Ghana, which is just our neighbor. So we need to up our own preventive measures to make sure that we don't record a case. Okay. So they are quite close.
Okay, so let's start with the monkeypox. What kind of symptoms would one expect from something like this?
So monkeypox is basically looks like a flu-like symptom, but it has a characteristic rash, right? So basically, some people may or may not have a rash. But what you would have are symptoms like cough, catarrh, body pains. Some may have a sore throat, okay, muscle weakness, fever, as though you were having a normal flu, okay? And after about 3 to 4 days, the rash appears. So this rash is common on the face, on your palms, on your feet. Okay, so that's a characteristic rash.
So when you say rash now, some people might think just little ones that you have with heat rashes. I believe they're more like the ones that you have with...
How do you differentiate the rash?
They're the kind that you have with chickenpox, I would assume.
Yeah, so it's more similar to chickenpox than just a normal plain measles rash, but it's quite big. It's bigger than the chickenpox rash. It has pustules, so it's they call it maculopapular rash, means that there's a liquid inside the rash, and it can pop open and dry up after a while. And throughout that period where the rash appears, it dries up, the scab appears, the dry patch, until a new layer of skin is formed. That individual can transmit it to another person.
Ooh.
Yeah.
So even after the rashes have cleared, there's still a period of time where the person is still...
Until new skin has been formed. That's when you're no longer infective. So throughout the period where you have a rash and it's healing, you're getting new skin, you are still infective. Yeah.
Let's talk about those during the second or third wave of the COVID-19. We were told that older people were more at risk contacting the third wave. So who are those that are at risk of contacting this monkeypox?
I would say everybody is at risk, but when you say at risk, I would say maybe at risk of severe cases of monkeypox virus, okay? And I would say the immunocompromised people that have a weakened immune system, either due to the fact that they're taking some medications, or they have maybe HIV, or they are pregnant, or children are actually more at risk. And these are people that also cannot really do much to protect themselves. Children play a lot, run a lot, touch things, touch people, and in that process, they can actually infect themselves. You know, they go to school and they play with other children also. So the children are more important to us because they have limited ways of protecting themselves right now that everywhere is open. But generally speaking, everybody is at risk.
Okay, they taught us about wearing nose mask for prevention. So what are the likely ways we can prevent contacting monkeypox? So
for monkeypox, it doesn't really work like that, because you need to have direct contact, either with the skin of the person that has a rash, or you're coming face to face for a long period of time. So there has to be that level of contact, or sexual intimacy too can lead to transmission of the virus. Or if the person has come into a space and probably they're infected beddings, clothing, or physical items, and you come in and touch those places that are already contaminated with the virus, and you touch yourself or it penetrates into your body, you can also come down with the virus. So wearing a face mask in this instance will not give you that level of protection.
It does share a lot of similarities with chickenpox.
It does. It does. They are from the same family of viruses. Yes, the chickenpox and the smallpox.
I do remember having chickenpox when I was in uni. A horrible time to have chickenpox. I thought about it. Now, what I found out, what the doctor told me, was that I didn't start treating my chickenpox early because, like you said, my rashes didn't kick in immediately the chickenpox started, which everybody assumes that's one of the first things you see when you're sick. Yeah. So you mentioned that with monkeypox, you have flu-like symptoms.
You could even have monkeypox and not really come down with a rash. You could have the rash and not have those symptoms. But usually in the classic cases, you have the flu-like symptoms first. Within the next 3 to 4 days, the rash appears. Yeah.
So at what point should you start worrying about that flu that you have and think to yourself, okay, I definitely need to do a little bit more?
I think at the point where you start seeing a rash, you should be worried, right? Because generally it will appear as though you had any other flu. So you would have the generic symptoms like fever, sore throat, cough. But once a rash appears, you should suspect, especially right now that it's coming up as an epidemic, you should suspect monkeypox and see a health professional immediately for proper diagnosis and treatment.
Okay. Sorry.
Is there any treatment for monkeypox, or is just, when you contact it, you keep praying to get healed?
Well, it's sometimes it takes its course, right? And you get better after a period of time. There are some antiviral medications that can be given, okay? But basically, they are just to prevent the severe forms of the disease. And very few cases lead to death. About 1 to 2% of cases lead to death. Yes, but fatalities have occurred. But more, there are some complications that could also come up. So yes, there are treatments, right? Not a cure per se, just to prevent complications, severe diseases, and probably death.
Okay, so let's talk about the origin of the monkeypox. I know recently they were talking about changing the name from monkeypox, so it doesn't seem like it's so closely associated to Africa. But in reality, is it not kind of closely associated with Africa?
It is. So it was first found in Central and West Africa. And it's a zoonotic disease. So a zoonotic disease is a disease that is primarily a disease of animals, but under favorable circumstances is transmitted to man.
Now, these favorable circumstances you speak of.
Favorable to the disease, because a disease, every virus wants to survive.
So it needs a host.
Exactly. So when it finds a susceptible host and that it can infect, right, it can cross transmit.
All right.
So, are you saying it crosses from eating these animals or from coming in contact with these animals?
Yeah. So both of them. So you could have from physical contact.
Not just monkeys, I assume.
Not just monkeys. You have the family of monkeys like the bats, right? Yeah. Yes. The chimpanzees and so on and so forth. So it crosses from the animal either through physical contact or through consumption. Right? Yes. So improperly cooked bushmeat, for example. Yes.
Since everything is bushmeat, if it comes out of the bush.
All right. Let's get down to the next disease that is very close to us. We're talking about the Marburg virus. Sounds new, and I would like you to explain to us or tell us more about Marburg virus.
Yeah, let's kick it with the origin.
Okay.
Since this one came from monkeys and other animals, where did the Marburg come from?
This one came from Marburg, a city called Marburg in Germany. Yeah. So basically, it was discovered in the early 90s, and it's a viral disease. No, it's not new. So it's basically what we call one of the viral hemorrhagic fevers. And these viral infections, basically what they do, they cause bleeding. They cause breakdown of your blood, of your red blood cells. Internally, yeah. There are also zoonotic diseases. Zoonotic, like I said earlier, from animal to man. So these ones originated basically from the chimpanzees, the gorillas, the apes, and so on and so forth.
In Marburg, I don't think they have these animals native to them.
Well, I would guess so. As at then, those animals were there because that was where it originally was found. But now
so
it's.
Do we just get rid of all monkeys at this point in time?
Not necessarily. As man keeps evolving and trying to adapt and also colonize new territories and environments, we disrupt animal territories, and it's a natural reaction. The environment always tries to compensate. So when you enter into the territories of animals, there are some diseases that in animals they may just be, as in they may harbor a virus and not be ill. But when that virus infects a man gets ill, right? Exactly. So those are the situations we are finding ourselves in, and as recently we are seeing more and more of these new diseases, which we call emerging and re-emerging diseases. So re-emerging means that they were there before, we have controlled them, and they are coming back.
Like Ebola.
Exactly. And even this Marburg too. Yes, it's an Ebola-related virus. They are all from the same family.
Does it have the same
transmitted
symptoms?
The same way, similar symptoms of bleeding through your eyes, your nostrils, jaundice, through any other parts you could have. So you have jaundice, fever, and it's also transmitted almost the same way through contact with the secretions, either your saliva, sweat, and so on and so forth, blood. So health workers are really more at risk
than every other person.
Exactly.
Yeah. Okay, so you mentioned that this Marburg one, it's been there before, it's coming back now. How do we handle it?
So there are several ways to handle it. You want to be avoiding animal to human contact as much as possible. Now we know that animals are responsible for most of these zoonotic diseases. So we want to be avoiding a lot of animal contact. We want to be avoiding eating a lot of these rare meats or bush meats that we call, right? And if you see someone that has symptoms that are likely to be Marburg, or since we know what Ebola symptoms look like, right, we could just use that to equate it. We could avoid coming close to them, touching the same, using the same clothing surfaces, and make sure that they are well taken care of in a healthcare facility. As always, we always say prevention and control is the best. So your hand washing, your basic hand washing, you can't have enough of that. So you should always make sure you wash your hands, as we've always advocated, as often as possible. Right. Okay.
Now, we've been talking to Dr. Isokriari, Dr. Ogechukwu Isokriari, and she's been educating us on not just monkeypox, but also the Marburg virus. But if you got any questions that you'd like to ask her before we let her go, you can WhatsApp us 0704 499 4999. That is 0704